The figures that we all are aware of were very clearly in the press just last week. I had the opportunity yesterday to ask the Minister of the Secretary of State in relation to it, and I asked because it was an opportunity, first of all, but it was also because of the backlog of operations, and I mentioned about tonsillitis, and I also mentioned about essentially where my notes are here. The other children here waiting for their adenoids to be removed as well. And those lists are growing not just here in the mainland, but indeed across the whole of the United Kingdom, Great Britain and Northern Ireland. The concerns and pressures that I have have been reiterated by those who have spoken before, and indeed will be reiterated by those who come after. The Minister, the Secretary of State actually who replied, referred to, and the lady who spoke previous will be interested, his figure was £7 billion to be available. So, and through the Barnett consequences, of course, we will, and Northern Ireland will get some benefit of that, and I understand that. But the Secretary of State did acknowledge that there was an absolutely massive backlog. But I'm just wondering, as we slowly get out of the coronavirus and the COVID-19 through the vaccine rollout, which we put on record our thanks to the Minister and to Government for all that they've done in relation to that, I think we do need to see a strategy in place that addresses the backlog of those who are willing to be seen. From the waiting list to see consultants to push back on surgery dates, coronavirus has brought us from teetering on the brink of surgical collapse to being under the rubble. It's as serious as that. And certainly in Northern Ireland, where the waiting lists are gross. The Secretary of State referred to it, it's not just in England, it's every region in the United Kingdom. Problems are recognised by the Secretary of State and by Government, and we welcome that. But while we do look to the Minister and with absolutely no pressure whatsoever to tell us what's going to happen and how those strategies will address the backlog. And maybe as well, Minister, I know that the Secretary of State always tells when he's right, by the way, and I know he does have regular contact with the ministers, the health ministers and the regional devolved administrations, and I welcome that close contact, always on the phone, every week, maybe 2 or 3 times a week. So I want to make sure that the coordination and strategy is one that's working across all of the regions. I want to give 2 examples and just to illustrate what the issues are. It happens to be one of my own staff, and she had two wee girls. One of them is a 5-year-old Lily. She was choking on her food and her drink, and after another bout, her mum looked in into her throat and saw the tonsils, and her words were the size of golf balls. So therefore, and a wee girl, a 5-year-old, you would panic right away. So she rang the GP, was seen and got an urgent referral to the ENT. She then paid private. That meant that she had to then borrow money for that to happen. I make the point because not everybody can do that, and that's a point I want to make. She was told the waiting list was over 1 year long for just the consultation. She went to the consultant and was then sent to her home with a sleep monitor, just to monitor to see where the problems were, and then that would report back to the doctor again. She left the monitor back after the 3 nights as requested and was contacted within 2 days to say that Lily needed urgent surgery as her oxygen levels had dipped dangerously low during the night. So she rang the hospital and was told that she would have to have the surgery on the first urgent slot in April. As April we're still in 2 weeks at the beginning of April, and it hasn't happened. So Lily is still waiting for her surgery, and her mother has installed a baby monitor which speaks if there's not enough movement. You know, Madam Chair, what a way to live your life with your young 5-year-old who you're an eggshell's over, your heart's in your mouth, you're listening to the baby monitor all through the night, and then you're almost afraid to go to sleep in case you might miss something that's happening, and the stress to the whole family resonates across everyone. This simple surgery would rectify this, and despite being the first on the urgent list, she is still waiting. It's not your responsibility, I know it's not, but I want to make it, because I'm pretty sure that the Honourable Gentleman who set the scene, and he had lots of examples, by the way, he didn't go into them all, but I tell you what, I suspect the Honourable Gentleman for Brittle would have examples which are very same as the ones that I'm referring to. For her mother, she has sleep-interrupted nights, ensuring that her child is breathing through the night. A simple procedure a simple solution, and yet for some unknown reason, the year has passed, and we don't seem to be any further ahead. I'll give you a second example. 42-year-old market trader who has worn kneecaps and whose business employs 13 local people. So his role, not just as a market trader, but as a person who employs 13 people, has told me unless he gets his operation, he's going to have to close one of the shops as he can't physically load and unload the vehicles. So we're losing business. So the impact of not getting your operations in time, not just affects children, but also affects those involved in industry and in the economy as well. It's about cancer diagnosis that the Honourable Lady referred to. It's about, unfortunately, I do know of people, Madam Chair, who have had cancer in the last year, and unfortunately, because they didn't have their operations, they're no longer here. And that's a fact. You know, I mean, when the Honourable Lady was saying that, I just said to myself, I can resonate with that. I understand. I know those people who are not here today because they just weren't able to do it. I understand governments had a responsibility to look after the COVID. I understand that. But I think the time is now coming where we need to look beyond that, and we need to have a strategy in place. So I look to the Minister for a response. On the hip and knee replacements, that example of the 42-year-old market trader is an example of those who need it right now and not years in the future. I also make the comment for cataract surgery. My goodness, I have lots of people here waiting. They're not even waiting for the surgery. They're waiting for the appointment to diagnose when they can do it, and yet know that they're going blind. And a simple cataract surgery operation can just change their lives with real dramatic and positive effect. Again, we need to be on the ball on these things. And I do understand when the Honourable Lady for Twickenham refers to mental health. And I've seen it in my constituency, the mental health of young children at school, as young as primary school level, by the way, in schools, are under tremendous mental health problems as well. This is not an ordinary problem only. Just under 4.7 million patients are waiting for hospital treatment in England as of February 2021, the highest number since the referral to treatment status started in 2007. While a relatively sharp decrease in numbers, waiting was observed from April to June 2020, just last year. The numbers have since increased to the record level of 4.7 in February 2021. It seems likely that the dip from April to June 2020 was due to a limited new referrals during the first wave of the coronavirus pandemic. So I always try to be positive, Madam Chair, whenever I come to any debates, because I think it's important that we do look. So it's not about, we give these background of examples because we want to set the scene of where the problems are, but everyone who's spoken before has very honestly and admirably, by the way, put forward solutions. So, Minister, I think we're all in the business of solutions. It's about the half glass full rather than the half glass empty. So we do need investment. We need access as well, Madam Deputy Chair, to private clinics, because sometimes we're going to have to look towards it. I think that's one of the things that we should be doing. And facilities, and we need that action now. For every day that passes, more people are in need, more are in pain, more are in fear. And we must get a hold of it. So as the list continues to grow, and more people again go on the list that is already there. So I believe what we need now, Madam Chair, is a clear strategy that prioritises where the backlog of surgical and elective surgery is needed. We need the £7 billion that the Minister referred to yesterday in the Chamber, which is extra money for this particular purpose. I think we want to see how that's going to be sent out. And we need more staff to be in place, to be employed. We need extra surgeons as well. We need to, whatever we have to do it, there has to be a plan. And I believe that we have a responsibility, and as my party's health spokesperson, I know that I'm very, very keen to see these matters addressed. I know government can do it. I know the Minister, and if they put their mind to the issue, Madam Chair, can make it happen. But each and every one of us here, we want to see it sooner rather than later. Thank you.